Get ready to invest in yourself and elevate your expertise with the Perio School podcast, brought to you by Perio School. It's Dr. Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school. In today's masterclass, we're going to be talking about communication, but specifically making gum disease explanations simple and understandable. What I've realized is that most perio failures, they're not actually clinical failures, they're communication failures. Patients also don't reject treatment, they reject confusion. And confusion almost always starts in the moment when we're trying to explain what they actually have, what's wrong. The problem isn't that we don't share enough information, it's that actually what we explain is not quite understandable to the patient. We sometimes think they understand these clinical reference points when we talk about BPEs or furcation involvement, and all of that is accurate, but actually it's pretty meaningless to the person sitting in the chair. So this is about translating. It's not about dumbing things down, it's about translating biology into relevance and relevance into action. Before we talk about what to say, I think it's worth understanding the gap we're bridging, because patients arrive with a fully formed narrative about their mouths, and it's usually wrong. They think that, bleeding gums are normal. I'm just having a scale and polish. I brush twice a day, so that's fine. Or my mouth is separate from my body. But actually, the reality is, as we know, active inflammation, healthy gums don't bleed. This is a chronic disease. It requires treatment. Brushing only covers a certain percentage, and it is linked with general health. It is linked with risks of diabetes, cardiovascular disease, all of that. So the framework that I think has worked pretty well is a 4-step framework. It's not a rigid script. It's just a way to think about your perio conversations. So step 1 is to visualize. Show them the problem. Gum disease is actually invisible, and there's pretty much no pain in early to moderate disease. Nothing the patient can see in the mirror, which basically means when you're trying to describe it, you're asking them to believe something where they can't actually see what's going on. So use your tools. Intraoral photography is absolutely key. Show them the photos. If something looks swollen, show that to them. Radiographs are a no-brainer when it comes to this. So you show them this is where your bone is, this is where it should be. And by the way, use the word jawbone. They can really relate to that. And they can see, gosh, all of this jawbone has dissolved away. Show them bleeding scores. Explain what they mean. So visualization is the first thing. The second thing is personalize. Make it matter to them. Because clinical severity doesn't motivate patients, personal relevance does. So you need to connect the diagnosis to something that they care about. So for some patients, it's tooth longevity. And research shows that deeper pockets have a significantly increased chance of tooth loss. So what I say to patients is if your pocket is more than 6 millimeters, you are 64 times more likely to lose this tooth. That's a high number. Are you sure we don't want to book you in for treatment? So use risk. You can use things like aesthetics as a motivating factor. Like if people are worried about black triangles or the gum line shifting, use that as a motivating factor. What about systemic connections, right? Some of them are worried about general health. So bring that in as well. And sometimes it's the financial reality as well, which is really important. And you say to them, look, if we don't treat this and you start losing teeth, do you know one implant is like £3,000, right? And our treatment plan doesn't really go over that for the whole mouth. So I think the second thing, so firstly, visualize. Second thing, personalize. Make it matter to them. The third thing is simplify. And this is key. If a 12-year-old wouldn't understand it, right, you need to simplify it. Again, it's not about dumbing it down. It's about creating clarity for that patient. So for example, how are you explaining pockets? I would say pockets is a space between your tooth and the gum, and that's where all the bugs are trapped, and that's a bit we need to clean. That's a bit we want to try and close up. So really trying to think of language that people understand and can relate to. The fourth thing is activate. So information alone changes nothing. This is the step that's most often skipped, and it's the most important. So the explanation was good, the patient nodded, you documented it. 6 months later, nothing's changed. because knowing and doing, they're separated by a significant gap, and that gap is behavioral, not educational. So when information alone isn't enough, what do we need to do? We need to be specific. We need to give specific goals that are timed, that are followed up. So something like, before next visit, one thing I'd like you to try is using this size incidental brush on the upper left molar every evening before you brush. Something really, really specific. And check that it's landed, right? Get them to sort of, in a non-patronizing way, like just repeat back. Just so you say something like, just so I know I've explained things properly today, would you mind just kind of summarizing what you're going to do when you get back? So, this is a tool for you to figure out, has my patient understood what I've gone through with them without embarrassing them, and then clarifying things as you need to. So I think try that next time when you're trying to make patients understand things and be effective, because we don't have a lot of time in general practice. You've got to be quick, you've got to be effective. So visualize, personalize, simplify, and activate. The goal isn't a patient who leaves with a perfect understanding of periodontal disease. The goal is a patient who leaves with one thing that they're actually going to do. Today's case discussion is a really important one. We're joined by Joss, head of Mouth Cancer Foundation, to discuss the vital role hygienists and therapists can play in the early detection of mouth cancer, particularly through regular periodontal maintenance visits and routine soft tissue screening. We'll be exploring key red flags clinicians should look out for, and how small observations in everyday practice can genuinely save lives. So, Joss, thank you so much for coming on the podcast. I know you're very busy with all your different hats and roles, so thanks for taking the time.
Thank you so much for inviting me, Reena. I really appreciate it.
I want to open up with sort of a scenario, right? So hygienists, they're in their day-to-day practice. They notice a persistent unilateral ulcer during their regular periodontal maintenance visits. They've been seeing this patient every 3 to 4 months. The patient's been completely unaware of it, no pain, just attending for their hygiene, for their maintenance. And I guess to start off, this raises a really important question. Something I always think about is, as hygienists and therapists, there's that almost like privilege plus opportunity to pick up these things. One of the only oral healthcare professionals, one of the only healthcare professionals actually, that see patients so regularly that they are able to be in a good position to spot changes in the mouth before anyone else. Do you agree with that? Is that something that resonates?
Absolutely. I mean, we take every opportunity to share knowledge about all sorts of things which we share with our patients. But actually, this information we share with our patients doesn't just stay with the patient. It goes with their friends, their family. It goes with their buddies down the pub, the friends they walk the dogs with, who might mention something. They go, oh, my hygienist or my dental therapist said you need to get that checked, and potentially save a life. So don't think that those conversations you have in clinics stay there. They don't.
Absolutely. That's a really, really fair point. Because sometimes that conversation in the pub is the most important one, where someone thinks, oh, actually, maybe I should get something checked out. In terms of hygienists and dentists who have a special interest in perio, obviously the unique part of periodontal disease is that we do have to see our patients regularly for maintenance to maintain their condition. With regards to continuity, when it comes to early detection, how important is that in picking up these changes?
It's vitally important. We know the statistics say that early detection and early diagnosis means that 80% of patients are going to be a good survival rate at 5 years. Late stage detection is 20% survival, so it massively drops. So it's having those conversations the first time you meet those patients in clinic. Be confident about talking about all the things that you're talking about perio-wise, but initially it's about health. We're all health professionals, so having that confidence to talk about what you're doing when you're performing a head and neck cancer screening, but also talking about the risks and the signs and symptoms. So should anything early appear, they come to see you. Have those conversations and encourage self-screening. We self-screen for lots of other cancers. Why not head and neck?
Exactly. And what are those key signs that clinicians should be actively looking out for during the soft tissue screening session?
So I always explain to my patients any lumps, bumps, ulcers, sore patches, sore throats. You're looking for red lesions, red and white lesions. You get to know the anatomy of people's mouths very well. And if something feels different or looks different, then have a chat with the conversation, have a chat with the patient, have the conversation to just go, well, have you noticed that? Let's take a photograph. If you can see something, take a photograph. Write down what the patient's saying. I mean, a lot of the times we're using digital note taking now, so there's lots of information that can be put into your notes and then review them in 2 to 3 weeks' time. Something's still persistent, something's still there, then please feel free to refer. Ask a colleague, always ask a colleague to come in and just check. You know, can you have a look at this for me, would you? You know, work as a team.
For sure. What are some of the most commonly missed or underestimated lesions, from your opinion and the research that's out there at the moment?
A lot of times, problems with tonsils are missed. Now, how many times when a patient's lying back, can you actually see the tonsils? It can be quite difficult in some patients. So you have to listen to what they're saying as well as what you can or can't see.
Okay, that's a really good point, actually, because we're always looking for the visual signs, but actually the symptoms and what they're saying is also equally as important. When a clinician thinks, okay, we need to refer this, we need to escalate this, what would a good referral look like? What's the current sort of gold standard protocol for these types of lesions?
This varies from trust to trust with actual documentation. So sometimes it's an e-form, sometimes it's still paper form. But make sure that you write down everything as clear and succinct as you can. If you go to the Mouth Cancer Foundation website, there's the 10 steps to how to perform a professional screening, but also look at the different pointers that Professor Mike Lewis, our Chief Clinical Ambassador, has created for what you need to do and how to describe things. Describe things well. Don't call it a lesion, call it an abnormality, but look for ulcers, look at sizes, look at colour, how long it's been there. So put as much detail in a referral as you possibly can.
Yeah, I like the fact that you mentioned about calling it an abnormality. I think that, again, from a patient perspective as well, because I think one of the things that we always panic about as well is having that conversation with the patient. And you don't want to panic them either, but at the same time, you want them to take it seriously. So what kind of phrasing has worked well for everyone when we come across this scenario?
So if you go to the Mouth Cancer Foundation website, on there it says lots of conversations that you can have with your patients. And one of them is, the question is, what happens if you find something? So you can say to the patient, if we find something, it does not necessarily mean that you have mouth cancer. We are only checking for something that we feel needs further investigation. Being referred to hospital means that the doctors can carry out the necessary tests to give you a diagnosis. So they will be worried. There's no way you can stop that worry because they're being referred. But early diagnosis is key, so the earlier you can get them into hospital, the better. And also, it's only the pathologist that can actually say it's cancer, you know. So a lot of things are sent and referred and then nothing, or something that needs to be monitored or something different. So refer, the colleagues will look after you, they'll triage, and then they will definitely see these patients of concern.
Makes sense. In terms of sort of from a medical legal aspect, you mentioned about taking a photograph, which I think is key because you can only describe in words to a certain extent. So you've got your photographs, you've got your notes, you've got your referral in place, and maybe you've got a second opinion. Is there anything else that we should be doing, or is that kind of sufficient?
I think that's sufficient. I think it's getting that referral off as soon as possible, having reviewed it potentially, or if you think it's very obviously something bad, then that needs referring straight away. But if it's something you're not sure about, but yes, that sounds absolutely fine to me. I think just give as much detail as you possibly can.
And obviously you mentioned earlier regarding the statistics and how early detection can make such a big difference. So you'd rather refer earlier than later, and then they just say, maybe nothing is there. You'd rather have that reassurance. Have you come across any cases where, or heard of any cases where, real life cases where early detection has really changed someone's life?
The potential problem and the complication of treatments can occur when the cancer then spread to the lymph nodes. This then becomes more involved with treatment, and it has a lot more drastic outcome, and people have got to live with that outcome and late effects. So the earlier you can see a patient and refer them, the better. So they may have surgery, and I'm not saying surgery only, but they may have surgery. They may not have radiotherapy. They may not have chemotherapy. And so actually they have far less life-changing problems, I would say. It's still an issue. Having part of your tongue removed, having part of your cheek removed, having part of your lip removed is still very detrimental to the patients, to their social aspects. It affects patients phenomenally, and they will always have something called scanxiety. So whenever the reviews come around, they'll always be extremely worried, but they'll be very grateful. And for those that have been referred early and had not the full involved types of treatments and therapies that people can have, they're very grateful to be referred early. So early diagnosis is key.
It's key. And just to talk about also patients who are undergoing cancer treatment, whether that's chemotherapy, radiotherapy, for us in especially in the perio world with dentists focusing on perio, but also hygienists and therapists, what can we do to make sure that we make their treatment as comfortable as possible? What do we need to be aware of for these patients undergoing treatment?
So more often than not, you won't necessarily see a patient, especially if they're going through radiotherapy or chemotherapy during treatment. It depends. If you're talking about general cancers, then some people are on chemotherapies for the rest of their lives. So as a team, we need to work with our oncology team. Hopefully, oncology team think about us, and then we can help the patients wherever they are in their treatment, because they need their teeth cleaning, they need their support. If they've got perio, they need that looking at. For a lot of head and neck cancer patients, they will have had plenty of teeth removed potentially that have got a poor diagnosis long term. So there is that conversation right at the beginning. So if they are, very heavily restored teeth, they've got a potential abscess there. If their perio is poor of a tooth or teeth, they will be removed. But for general patients who are going through cancer treatment, we need to be referring to the oncology team, because there's so many different kinds of chemotherapies now, so many types of different types of therapies that are used in combination of, and it's very patient specific now. So you can't say because they are a breast cancer patient, there are 13 types of breast cancers, there's 100 types of chemotherapies. So it's complicated from that school. So yes, connection with the oncology team is vital.
Yeah, for sure. And I think, as you said, there's no blanket answer for, it's dependent on the patient, depending on the cancer, depending on the treatment. And I think it is about, and hopefully that is the way things are going. We're all working together holistically as a medical team, which is the way kind of it should be. So yeah, for sure. I have one last question for you. If there's one thing you'd want every hygienist, therapist, clinician listening to this episode to remember, what would that be? One take-home message.
Don't be frightened of doing intraoral and extraoral examinations. Please go to the charity website, have a look, see how we do it. We've created a new video, which is fabulous. But don't be frightened of having that conversation with patients and mentioning the word cancer. The research shows that actually as clinicians, we're the ones that are worried about saying it. The patients aren't worried about hearing it. So the sooner you can get that conversation going with your patients and do from the get-go, they are expecting their head and neck cancer examinations each time they come to see you. And the charity is there for supporting professionals too. So please get in touch. But hopefully that's a top tip for you there. But yes, start doing those intraoral and extraoral examinations and having those conversations, please.
No, and it doesn't take long, does it? And those few minutes can change everything for someone. So I think it's
absolutely.
How busy we are. Every single clinician makes time for it, for our patients. Joss, thank you so much. As you said, please, for everyone to check out the resources on the Mouth Cancer Foundation website. There are so many helpful things there for everyone. Thank you for all your efforts and all the work you're doing for the foundation. It's so inspiring, genuinely changing lives. So thanks again for taking time out of your day, and looking forward to speaking again soon.
Thank you very much, Reena, for inviting me. Absolutely delighted to help you and support your podcast, and to your listeners. Thank you very much.
Thank you.
Hi, Dr. Sophia here from Perio School, and I'm very excited to share testimonials from our delegates who have just graduated from International Diploma for hygienists and therapists. Just before you go and listen to the testimonials, I just wanted to share that registration for the diploma is open for 2027, so make sure you register, because the places are filling up really quickly.
Well, hi, my name is Claudia. I'm originally from Romania. I have been in London since 2011. The course, I decided to go ahead to study for the diploma because I've always had a special interest for perio. It's been a thing that I've always been drawn to, probably because of the ambient in the practice where I used to work, and here I am. Well, the practical days, they've been intense, lots of information to take in, but overall it's been very good experience, learned a lot of new things. It kind of put everything together, what we've learned online in the classes to how to actually put it in practice. It gives us a huge benefit for when we go back to our surgeries. Overall, the patient's journey from coming to the practice to leaving, how we actually manage the conversation in the surgery with the patient, have things organized step by step so we don't miss things, or taking advantage of what the patient is feedbacking to us as well, and using that towards the treatment plans to overall get a better outcome of our treatment. The class is quite engaging, and people who know me, they know I've always got questions and I'm not afraid to ask the questions, and I'm really happy for receiving the answers that I was looking for. I would 100% recommend the course to any hygienist that's interested in advancing their skills in periodontal disease. For me personally, it's been a major change already, and I'm looking forward to see what other changes I'm going to be able to make long term, putting everything into practice.
Hi, this is Vidya. I'm an overseas dentist, but I'm in this country for the past 2 years and working as a hygienist and therapist. The most important thing from the past 2 to 3 days here is that we had few delegates, and Reena was so kind to come each and every one of us and see where we are going wrong, correct us, take time to tell us where we are going wrong. And I should say the photography and the radiography lessons, especially amazing. So we had time to work on, ask our doubt, clear our doubt, which is really great thing and amazing. And to be honest, I'm gonna invest myself on a camera very soon. I'm gonna start with the pictures, and I've got that confident now. I don't know, I got that confident now. This is really great.
So my name's Ellie Solman, I'm a dental hygienist, and I'm here to do the postgraduate diploma in Periodontics with Perio School. I wanted to up-level my skills as a dental hygienist to be able to treat more complex periodontal cases. I thought it would be nice for the patients to have an option to stay within the practice, and as we offer more complex restorative and implant treatments, it's good to up-level my skills to be kin with my colleagues. And got to try lots of instruments that I would have maybe never tried if I hadn't come here, because different ones were available, and to get lots of tips and tricks off several different clinicians that were offered to come and do lectures, then that was really valuable too. I really enjoyed the periodontal consultation, about making dedicated time and space to have a consultation rather than to go from a hygiene appointment straight into treatment. So I think I'll implement a consultation phase at practice, and to be honest, to just up level in every area, to just make every bit, even how to welcome patients, just slightly better, I think will just up level my practice across the board. It was delivered with passion, it was interesting and informative.
We are delighted to welcome to our quickfire My Dentistry Live Q&A Professor Iain Chapple. Professor Chapple is one of the most recognised and respected figures in periodontology internationally, renowned not only for his clinical and academic contributions, but also for shaping the way many of us think about perio care, research, and the wider impact on oral health. He is a professor of periodontology at the University of Birmingham and has authored hundreds of scientific publications, contributed to landmark periodontal guidelines, and played a key role in advancing our understanding of the links between oral and systemic health. On a personal note, Iain has also been someone whose work and guidance has had a meaningful influence on my own journey. He has been a mentor to many within our profession, myself included, and someone who consistently combines world-class experience with warmth, humour, and generosity. So we're very excited to go beyond the CV and learn a little bit more about the person behind the periodontist. So Iain, thank you so much for joining us.
Thank you, Reena. That's a very kind introduction. Very flattering, but it's my pleasure.
So we're going to get straight to it. I want to start off with how does your day usually start? What's your sort of ideal morning routine?
Well, it starts with me waking up normally, thank goodness. The day that doesn't happen, I'm in trouble. It varies between weekends and weekdays, I guess. So weekdays, I'm a typical periodontist. I'm a bit OCD. So I wash and I shave with an electric shaver. And when I'm shaving with my electric shaver, I do knee exercises, knee bends to protect my ACLs. Then I go into stretches when I'm using my electric toothbrush. So I multitask. I'm a guy, but I can multitask. And then, having dressed, I go downstairs. I have a bowl of low sugar cereal with blueberries and raspberries every morning, creature of habit.
Excellent.
And then I drive to work with a cup of tea. I cannot drive to work without a cup of tea. The routine's the same at weekends, with the exception that I do a couple of 5K runs before breakfast. So I go out for my run out the back door and into the fields and hills, and that's what happens at weekends.
Amazing. Ticking all the boxes for good periodontal health then. General health and oral health. So 3 things we can find in your work bag, things that you just can't live without.
It's really boring, I'm afraid. I was the kid that went to school with all the textbooks in his bag and never read them. So you will always find paperwork, publications, PhDs, and marking, whatever it may be. There's paperwork, my green laser pointer, from lecturing, the slide changer, and my laptop. I'm afraid those are the 3 things.
I have to say, you are instant with your email replies. I always say to everyone, it's very impressive. So I can imagine you having your laptop with you or your phone with you all the time.
Yeah.
Do you prefer print when you're working through like publications and reading through? You prefer print or you prefer paper?
I prefer paper because I mark things up, and I know you can do that on e-versions, but sometimes I read electronically, but if I'm marking something up and really thinking about it, I need paper.
Makes sense. Outside Perio, what topic would you happily give a 1-hour lecture on?
Oh, well, that would have to be oral medicine, I guess, because I always found oral medicine pathology very interesting. And when the guy that led oral medicine in Birmingham for many years, brilliant guy, when he was training down in London, I ran the oral medicine service. And so I got very familiar with all the blood tests and all the investigations. And I just find it really different. It's quite nice when you're in a surgical discipline to have the medical side as well, because the contrast is quite, it's quite stark. The way you think with medical management is very different to the way you think with surgical management. And I quite like that challenge. So that's probably what it would be.
And I know you have, even though you're are you semi-retired? Are you?
Supposedly.
So, even though you're probably busier than you've ever been, it seems like. Every time I see you, you're full of energy. But how do you actually switch off and recharge? Because I guess that's an important side to make sure you're, in good and in a good place as well.
Well, that's a good one. The switching off and recharging. To switch off, I read crappy novels.
Okay.
So crime thrillers, stuff that, my wife looks at and thinks, I'm so embarrassed you're reading that. But it's easy. I'm reading academic papers all day or most of the day. And it's quite nice just to pick up something that you don't have to really engage your brain much with, but it's entertaining. So that's probably how I switch off. Recharging, I think the body's a bit like a dynamo. So to recharge it, you've got to do something energetic. So for me, recharging is exercise and making sure you get 7 or 8 hours sleep a night, which I'm not brilliant at. But when I'm on holiday, I will do that. And the only other thing I suppose that I really switch off with is I just love going to the theatre. Nice. So if there's if I'm at the theatre or at some kind of music show, particularly if one of my 2 daughters is performing, then I'm completely immersed, listening for every note. But generally that helps me to switch off as well.
Lovely, very nice. For those of you who don't know, Ian's daughter was in Matilda, so very, very impressive. If you weren't a periodontist, what do you think you'd be doing?
Oh, that is a good question. Probably a forensic psychologist. I find I find people's behavior really, really interesting. I love watching people. I find it fascinating, just trying to work out, why they're doing certain things, why they're behaving that way. That's probably what I would. I don't know if you remember Desmond Morris, the guy that wrote about, taking us back to the apes and our behavior and how we evolved through that. And I find that really, really interesting. So that's probably what I would do, forensic psychology, probably.
Nice. Okay, this is a tricky one. How would your colleagues describe you in 3 words?
Oh, annoying. Well, it depends if it's negative or positive, I suppose. So negative, they'd probably say I was intolerant.
Really?
Impulsive.
Okay.
And probably too ideas orientated rather than practical and having to worry about the detail. Positive, I don't know. I mean, the only thing I can go on is my 360-degree appraisal, because that's where people tell you what they really think about you. And the positives from that would be, I guess, my work ethic. I've got quite a strong work ethic. I believe in hard work. I try to inspire younger people because they inspire me. So it's quite nice to get somebody really interested and inspired in the subject. And I have been called a bit of a maverick, but I take that as a compliment.
Absolutely.
I hate rules.
Many more positives, Iain. So, and you mentioned, inspiring younger individuals, and you've worked and mentored so many people. From what you've seen over the, many years, what do you think it takes to make a great clinician? I know we focus on clinical, etc., but what are those attributes that you've seen, and you've seen people progress? We've known each other for many, many years. You've inspired so many people. What do you think stands out for the people who do really well?
Constantly striving to improve, never accepting that you're good enough. I think in all aspects of your work. I think always learning something new, and being open-minded enough to think I got that wrong, or the field's changed, or there's a new method that's better than the one I was using. And I think for me that's what it's about. I think the day you stop learning is probably the day you need to retire. Just strive to be the best you can. There'll always be people better, but that's okay. As long as you strive to be the best you can in the different aspects of your life, then you'll end up with a fairly balanced level of what I hope is high performance.
Yeah. And there's always things to learn, no matter which stage you're at, I'm
Absolutely.
sure. And whichever field as well. So, you've achieved so much in your career. It's so admirable. I've always been, since the day we met, I've been inspired by you. For you, what has been the most memorable moment in your career from all the things you've done?
Gosh.
You could pick one.
I think it's really hard, but for me, no, it's really clear. For me, the most memorable bit in my career was the end of my career. It was when I first retired 3 years ago. And 3 of my colleagues secretly organised a retirement symposium. So that was Moritz Kebschel and Thomas Dietrich and Nicola West. And it was just unbelievable. 350 people turned up from 27 different countries. And it was just really, really, I don't know, it was just humbling. It was the friendship, the collegiality. For me, that's what Perio is about, the kindness, the humanity, that people made that effort. And I did find myself welling up a bit on a couple of occasions, because I thought, my God, these people, they've made such an effort. And we just had a great party after this symposium, obviously. But my family were there, my kids, my wife, my father, my sister. It was just a very emotional and a very, very lovely event. And for me, that meant more to me than probably anything else. It was just the fact that people made the effort, I just thought was just amazing.
Yeah, and I think what you said about that community, and I think definitely within the Perio side, there's such a nice community, and that kind of sharing the kindness, it makes all the difference. Because at the end of the day, we spend a lot of time at work doing what we do. It's all about enjoying it and sharing the learning as well.
Yeah.
Is there one lesson that that dentistry has taught you, but about life, from the things you've done, that you can actually apply just in life in general?
I always like to quote Lord Henry Cohen. He was kind of president of the GMC, and the Royal Society of Medicine actually as well. And he once said, the feasibility of an operation is not an indication for its performance. And I love that, because if you think about it, what it's saying is, we all love to do surgery and complex stuff, but actually sometimes it's not right for that patient. So I think that dentistry's taught me that it's about what's right for the patient and putting the patient at the center of everything we do. And just because we want to do something and we think it's the right thing for them, it might not be the right thing or what they want, I should say. So I think that's important. Patient at the center, being honest. If you mess up, be honest with your patients. They'll always respect you and be grateful that you've been straight and honest with them. So I think honesty and putting patients at the center and not doing stuff just because you can, I think that's a really important lesson.
For sure. I have two more questions for you. The first one is advice that you'd give to your younger self. Now, looking back on your career, any piece of advice or quotes or life philosophy that you'd want to kind of say to your younger self now that you're looking back?
Yeah, probably. Two things. Michelangelo, the greatest danger isn't that we aim too high and fail, but it's that we don't aim high enough. And we succeed with a low bar. So it's the old adage, isn't it? So aim for the stars and grab the moon. If you miss it, you're still going to come away with something very special. So for me, I think that's really important. I think you need to be ambitious and realistic at the same time.
Yes. Very good advice. And my final question to you is, now that you're on this final phase of your career, looking back also now on what success means to you, has that changed since you, for example, went into dentistry? Now, what I mean, everyone has various different definitions of success. What is success to you now?
That's easy because somebody once asked me when I got my chair in 2001, they made some comment, oh, you've been so successful. How do you feel about it? And I didn't feel like I'd been successful at all. And actually I hadn't. And my response was, well, actually, come back to me in 30 years' time. And if I'm still enjoying my job, I'm still married to the same person, and I've got normal, balanced kids with good values, then I would call that real success. Because, we all focus a lot on our careers and our work and sometimes not the people around us. And I think getting that balance right is different for everybody. Some of us have incredibly tolerant families, and I'm thinking about myself here, incredibly tolerant and forgiving, and others don't. But I think you have to titrate what you do to fit in with that family life. And so for me, that's what success is about, really. It's not the degrees you get or the awards you get, whatever it may be. It's actually about, still enjoying what you're doing after a long career and having a good family life as well.
I couldn't agree more. And for sure, for me, since having the two kids, I think it's completely put everything into perspective. And I think, being grateful for that is such a blessing. Iain, I know you're super busy today. Thank you so much for taking the time out and sharing the kind of behind the scenes. Looking forward to seeing you again soon. But thanks again for your time.
Absolute pleasure. Thank you, Reena.
This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school.